We introduce PhenoBlocks, an interactive visual analytics tool that supports clinicians during differential diagnosis of patients with rare hereditary diseases using pairwise comparisons between a new patient and existing diagnosed cases. Phenotypes are the primary data type used by clinicians when making a diagnosis. A phenotype is an observable and measurable deviation from expected morphology, physiology, and behavior. The Human Phenotype Ontology, or HPO, is an international project that standardizes phenotype terminology and describes semantic relationships using is-a multiple inheritance, resulting in a hierarchy from general to specific phenotypes. The HPO includes over 10,000 terms. In a given query patient, a phenotype may be present, absent, or unknown. When comparing two patients, this yields 9 possible states for each phenotype, which can be categorized as similar, divergent, missing, and unknown. In PhenoBlocks, we convert a list of patient phenotype terms into a hierarchical dataset by representing them within a subgraph of the HPO. We facilitate comparisons with a consistent structure, achieved by calculating the union of all patient subgraphs. To demonstrate the utility of PhenoBlocks, we present a use case scenario with a hypothetical undiagnosed patient. Our first step is picking out 2 prominent phenotypes in the patient, short stature and absent speech. We enter these into PhenoBlocks to generate an initial set of reference patients. The resulting visualization displays the comparison of these phenotypes with 5 diagnosed reference patients for 3 disorders, grouped by row and ranked by overall similarity. Each visualization shows a subgraph of the HPO. Terms become more specific towards the periphery. Green colors indicate shared phenotypes. The deeper green color intensity of floating harbor syndrome references indicate more important shared phenotypes than the other 2 diseases, microcephaly capillary malformation syndrome and Chudley-McCullough syndrome. Let's look closer at the details of the first floating harbor syndrome comparison. Note that the shared feature of short stature has a deep green color. Hovering over it reveals that it has a high frequency in floating harbor syndrome, 90%. The orange color, in the small multiples, indicates it is missing in the other disorders and occurs with low frequency in microcephaly capillary malformation syndrome. Also note that while absent speech does not appear in any references, its direct ancestor is an important shared feature. Our working hypothesis is that this patient has floating harbor syndrome. Thus, we want to find potential disconfirming evidence for the other 2 disorders. To do this, we look at informative phenotypes that are present in the references but unreported in our query terms. Each visualization is partitioned into major subsets of the HPO, indicated by icons along the outer rim. We notice that the head and neck and skeletal partitions contain several informative phenotypes that are unknown in the query patient. Looking closer, we see that 5th finger distal phalanx clinodactyly is a highly informative phenotype. In this scenario, this phenotype is present in our patient, so we update our query. Notice that as we add phenotypes to our query, the visualization automatically updates the strong shared features. Also notice that in the other diseases, where these features are not shared, more orange appears. Orange can be used to gauge how different the query features are from the given reference. The other 2 disorders only show green shared features near the center, which indicates these shared features are less specific. This is a simple example of how PhenoBlocks can be used to visually explore the similarities and differences between an undiagnosed query patient and a set of diagnosed reference patients. Clinicians can use PhenoBlocks to prioritize the order of their clinical investigations and generate and evaluate diagnoses. PhenoBlocks has many features that aid in the comparison of patients with rare genetic disorders. Interactive legend. Clutter reduction with animated transitions to support change awareness. And filtering by top-level categories. And advanced editing.